It's time to evaluate your health care insurance. In less than 2 weeks, under the Affordable Care Act, you'll have the option to choose which plan is best for you and your family, regardless of your job, pre-existing health conditions, or income.
It's a plus for millions of Americans, but others see this plan breaking their bank. KHQA's Brooke Hash joins us live in Quincy with the breakdown.
The new marketplace hits the web on October 1st at a site that allows you to search for the best and affordable health care for you and your family. Now, breaking down the cost of the Affordable Care Act gets really tricky and complicated. In fact, if you talk to a lot of people, even in the healthcare industry, their answer is they simply don't have one for an exact cost. I found out that's true everywhere you go, but I do know it all starts right here. Beginning on January 1st of next year, an estimated 30 million Americans will have health insurance previously denied to them for a variety of reasons. Some health providers and the federal government disagree about what it will cost to insure the previously uninsured.
The most expensive place to go to seek health care is to an emergency room.
For nearly 50 million uninsured Americans, the ER is their only option.
And they have to receive care. Those hospitals receive federal money for charity care to help pay for that care for the uninsured.
The federal government says the Affordable Care Act will not add to the federal deficit, but rather shift the funding to better uses.
If we are reducing the number of uninsured by 20, 30, 40 million, we don't need all of that federal dollars for charity care. That charity care dollars are being shifted to help pay for things like the tax credits, the subsidies, Medicaid expansion.
In the end, it's so worth it to have people able to sleep well at night, knowing that they won't be hit with a medical bill that could take them under.
Amy Whitcomb-Slemmer comes from Massachusetts, where 96% of its residents are insured. The state implemented a law similar to the Affordable Health Care Act back in 2006, signed by then-Governor Mitt Romney. She said many people then voiced concerns about the potential for insurance rate spikes.
Health insurance rates actually went down so that individuals and some small businesses had significant savings based on the fact that there were more people to insure and they had access to better services than what they had before we implemented the law.
Slemmer says the state is just now starting to see a difference in the number of ER visits. She expects that number to drop significantly with more reform in the state's healthcare delivery. That would include additional walk-in clinics and longer hours at the doctor's office. But not all doctors agree this will work.
You'd like to believe that you're going to reduce the number of emergency room visits, you're going to reduce length of stays, you're going to actually keep people out of the hospital, which is going to reduce costs. And some of that will happen, but I just don't know whether from a bookkeeping perspective it's going to really balance it out.
Dr. Linton Johnson with the Hannibal Clinic says it could cost some physicians their jobs.
You are seeing nationwide significant consolidation of health care. You are seeing a significant reduction in the number of private practice physicians in this state as well as in many other states. And what's happening is you're getting large systems, hospital systems and multi-hospital systems, which are really becoming the dominant players in healthcare.
Analysts say it could take months, if not years, to realize the total cost of the Affordable Care Act. To read more about the costs associated with the Affordable Care Act, you can head to our website at connecttristates.com, where you'll find more information on the marketplace. Again, that takes effect on October 1st, where you can sign up. Also, tomorrow at 5 o'clock, KHQA has a special healthcare marketplace now, where you can get all your questions answered from local healthcare professionals. Reporting live in Quincy outside Blessing Hospital, Brooke Hash, KHQA News.